Suicide might be a root cause of more opioid overdoses than we thought. This is written by Mark Gold, MD, and printed in addictionpolicy.org, updated October 16th, 2022. An intentional suicide attempt by fatal drug overdose refers to an individual seeking to overdose in order to end her life. This may sound straightforward enough, but the issue is much more nuanced and related to how we understand and respond to the opioid overdose epidemic. If all overdoses are considered accidental until proven otherwise, we may be missing higher rates of suicide and depression and different approaches to prevention, identification, and treatment. How exactly can coroners and officials who write on death certificates determine whether someone intentionally wanted to die by overdose or unintentionally died by overdose without any desire to die at all? The directors of the National Institute of Mental Health and the National Institute on Drug Abuse recently reviewed the literature linking overdose and suicide. Up to 30% of all accidental overdoses are actually suicides. They observed that controlling for other conditions, suicidal thoughts are 40 to 50% higher among individuals misusing prescription opioids, and that people with the prescription opioid use disorder were also twice as likely to attempt suicide as individuals who did not misuse prescription opioids. In the U.S., suicide rates are increasing and overdoses are increasing. The life expectancy is decreasing. Deaths of despair, they're often called. Between 1999 and 2009, opioid-related suicide rates doubled. Opioid-related overdose deaths among Americans and adolescents have also surged, and both opioid-related deaths and suicides have increased to epidemic levels in the United States. Dr. Nora D. Kolkow and Maria Quendo have written that declining motivation to live can range from engagement in increasingly risky behaviors despite a lack of conscious suicidal intent to frank suicidal ideation and intent. Most of what we used to think as a leading cause of death has been decreasing. Deaths due to cardiovascular disease, cancer, stroke, and lung disease have all been steadily decreasing since 2000. But deaths from drugs, alcohol, and suicide have been increasing. Things have changed so much and so fast that more U.S. deaths now result from self-harm than even diabetes. Suicide is more than twice as common as homicide in the United States, and accidents, which may sometimes be covert suicide, make up the other leading causes of deaths. The major default manner of death assignment for injury cases contains misclassified suicides. Yet little attention has been paid to these deaths' contributions to overdoses, suicide, and addiction. And in a recent study, nationally recognized research leaders explored the connection between opioid-related overdoses and the spectrum of suicidal motivation. What did this study find about opioid overdose and suicide? The study found that a significant number of treatment-seeking patients with opioid use disorder have suicidal motivation prior to non-fatal opioid overdoses. We know that drug use, alcohol use, and substance use disorders are often accompanied by depression. Experts have debated this chicken and egg for years, which comes first, depression or opioid use. Suicidal motivations may be better understood as a background or underlying continuous issue for patients with SUDs, a continuum along which the drive to complete suicide varies over time. Quantitative analysis of suicidal motivation before overdose is a gap in research on this topic, and this study set out to measure the extent to which patients with opioid use disorder may experience various degrees of suicidal motivation. This Harvard McLean Hospital study asked participants about their desire to die before their most recent opioid overdose and the perception how likely they were to overdose. Participants filled out questionnaires and rated their suicidal motivation and the likelihood of overdose on scales from 0 to 10. For suicidal motivation, a rating of 0 meant no desire to die, and 10 meant I definitely wanted to die. And for the likelihood of overdose, 0 meant no risk of death, and 10 meant I definitely thought I would die. This study recruited participants from an inpatient detoxification stabilization unit. 120 patients over the age of 18 completed the study's measures. Their mean age was 34, 85% were white, and 41% were women. 60% had a psychiatric disorder, 25% were receiving mental health treatment, and 32% had attempted suicide in the past. In order to participate, the study required patients to be undergoing substance use disorder treatment and to provide written consent. An astounding 58.5% of the participants said they had at least some desire to die before their most recent opioid overdose. And only 41.5% said they did not want to die, a 0 out of 10. This is quite remarkable when you remember that we had all assumed all overdoses were accidental until recent work began to look at the association between depression and overdose. 36% said they had a strong desire to die, a score greater than 7 out of 10. 21% reported 10 out of 10. I definitely wanted to die. 30.2% of participants said that they believed it was not at all likely they'd overdose. 13.2% said it was extremely likely. The study also found that 92% of participants tended to have used heroin or fentanyl. It suggests that the results are consistent with the idea of suicidal motivation as a spectrum, given variations in participant responses about the desire to die, and that suicidal motivation before opioid overdose is common. Why is this important? Dr. Hilary Connery and her Harvard University co-authors write that the classification of a drug overdose is either unintentional or intentional. May not always reflect accurately upon either the behavioral episode itself and the treatment interventions most appropriate for preventing drug-related mortality. These findings are important in part because of suicidal motivation underlies an important number of opioid overdoses. Our approach to education, prevention, and treatment of opioid use disorder patients needs to change. This McLean Hospital team did very important work here, and previous research on heroin use disorders showed low suicidal intention during overdoses, but did not gauge the spectrum of suicidal motivation. This research extends theoretical thought-provoking work done previously by Valco and Quandro. The study says, for example, that efforts to help patients from curbing prescriptions to expanding access to healthcare and effective medications might not do anything to address suicidal motivation. Where is the psychiatrist, psychologist, and mental health expert in the evaluation of patients who have been rescued with naloxone or enter programs for medication-assisted treatment? Often patients do not have a psychiatric consultation in the hospital or emergency department, or an evaluation of comorbid depression, anxiety disorders, or trauma. Better screening standards and techniques and more effective and targeted versions could help healthcare providers more accurately assess the range of challenges patients face, and develop a better recognition of the kinds of treatment options that may be required in different situations. Screening standards specifically targeting suicidal motivation in opioid use disorder patients could save lives and improve outcomes. But the idea would be to evaluate patients earlier and not wait until they are actively suicidal. This study is important because there's very limited actual data on depression, suicidality, and overdoses, and this study starts to fill the gap. But it also has a small sample size and relies on self-reporting measurements. It did not gauge support systems for patients or their exposure to adverse childhood experiences, and it's limited by the demographics of its participants. More research is necessary to determine the links between suicidal motivation and opioid overdoses and the effectiveness of efforts to stop suicide. At the same time, there's a substantial amount of research drawing attention to connections between suicidal motivation and overdoses. In my own work, I've pointed to data suggesting that some number of opioid overdoses are better thought of as suicide attempts, and the total number may be larger than imagined. This study may be limited, but still providing legitimate quantitative data about suicidal motivation. I think Mayo Clinic's Tyler Oster's advice to evaluate for medical, infectious, psychiatric, and other comorbidities is important, and that it's supported by this study. 20 to 30% of the individuals with opioid use disorder say they have previously attempted suicide and unintentional overdose. And we know that those surviving overdoses face a heightened risk of suicide. The study also notes that there were several associations between overdoses and suicidal behavior in individuals with opioid use disorder, including a history of injection, polysubstance use, sexual or physical trauma, heroin use, and pain, among other correlates. It's difficult to tease out the contributions of trauma or depression and anhedonia to an overdose, and even harder to know what it all means for public health policy and responses to the opioid overdose epidemic. It seems obvious that individuals with opioid use disorder who die of fentanyl overdoses are often not deliberately even seeking fentanyl, let alone death, and it's important to look at actual data. These new data are actually finding, not conjecture. If focusing on depression, anhedonia, and despair can help save the lives of some patients, it's worth paying more attention to suicidal motivation. It's also interesting that the study finds some opioid use disorders reporting a strong desire to die before their most recent overdose without believing that they were actually likely to overdose. Drugs of abuse cause structural changes to the very brain systems that we rely on to estimate risk. This study points out that use may compromise self-assessment of dangers, leaving some patients in jeopardy after they did not realize the life and death risk they were exposing themselves to. Better prevention and education initiatives could help here, not just by trying to stop suicide, but by helping patients realize the genuine risks of their attitudes and behaviors. Rather than assuming that all overdoses are accidental, it's time to consider reversing the burden of proof by considering them suicide attempts, as his colleague had recently suggested.